B cell. Okay, so now the T cell has activated the B cell, and the B cell is going to start to produce plasma cells. And those plasma cells then produce antibodies. Now here's the thing. These antibodies that are produced, they bind to a special white blood cell that we have also in those tissues behind the mucous membranes. They're called mast cells. And the antibodies bind to these mast cells such that the Fc region of the antibody is bound to the mast cell, and the FAB regions are exposed to the environment, like so. So just the opposite of what you would expect, but not really. Okay, so now what's happened is this mast cell has been sensitized. So we can say the mast cell at this point has been sensitized. This is your first exposure to the antigen. And this is what happened with the dogs. Their first exposure, what happened is that they became sensitized to the antigen. Now, when you get exposed to the antigen a second time, so that there is a second exposure, what we see is that the antigen then binds to the antibody on the mast cell. And when a couple of antibodies get bound by the antigen, a cross-link forms and the mast cell starts to degranulate. And as it degranulates, it releases histamines into the environment. And what do these histamines do? Well, they cause the reaction. Maybe they cause us to have a runny nose, runny eyes, increased mucus production from the histamines. Hay fever is a result of this type of hypersensitivity. Of course, in order to treat the symptoms, we often will take antihistamines to help us with our hay fever. If the condition is localized, then we see the development of hives. So what you get is fluids moving out of the circulatory system into the tissues, and so you get those hives that develop what they might call a whirl or a wheel and then a flare. So what you have is the hive develops, and then you have a rash kind of around that hive. Lots of things can bring on hives. Hot water. I've seen people take hot water showers develop hives. They're short-lived. They're there for a few minutes and then they're gone. Exposure to different fabrics and materials and stuff can bring about hives. Latex is one of those things that can cause hives. About 20 to 30% of the population has this type of hypersensitivity. Hives are localized. Hay fever would be a more general, actually it's more respiratory. One more respiratory condition that we can talk about here is asthma. And Asthma is a hypersensitivity that develops as well, but it is inflammation of the bronchial tubes. And it is caused by a different chemical than histamines. Prostaglandins are more responsible for asthma. And so it takes a different type of treatment. Okay, you can't take an antihistamine for an asthma attack. Albuterol is what's prescribed now. It's a bronchial dilator, opens up the bronchial tubes. Any questions, any comments? Well, sometimes you have a condition where your hypersensitivity is generalized. What this means then is that the entire body is affected. Instead of just one area in a localized condition, the entire body responds to the antigen. This can be extremely dangerous. In fact, this leads to anaphylactic shock. Because think about what happens. In this situation, what you're really experiencing, and basically most of these are just inflammatory responses. Inflammatory responses to the antigen. Well, now you've got an inflammatory response body-wide. What does that mean? That means, if you think about what happens in an inflammatory response, is that your vessels dilate, all of them dilate then, and fluids start to move into the tissues. This is happening body-wide, so now if you've got lots of fluid moving into the tissues, your blood becomes very thick, your blood pressure drops, and if you don't address the situation immediately, you die. That's the problem with the anaphylactic shock, is that it's a system-wide hypersensitivity. And so you lose fluids into the tissues, causes the low blood pressure to develop. Any questions? When I was a child, 6th grade, 7th grade, I had lots of hypersensitivities. They put me out on a table once and they pricked my back with 100 different things to see how many of them I had a response to. I was 6th grade, I think, when this was going on. And can't remember the count, but it was a lot. It was high, like 92, 96, something like that. Small reactions, but reactions nonetheless. And so the doctor at the time decided that I needed to undergo immunotherapy. Immunotherapy is an attempt to sensitize your body, if you will, to the antigen or the allergen so that you don't respond to it. And so for, I forget the time again, I think it was about 12, 18 months or so, 2 times a week, my mother would take me down to the doctor's office and I'd get a shot in the arm. What they were doing is they were introducing different antigens at small doses so that I was getting exposed to these antigens at those small doses in hopes of reducing my sensitivity to those antigens. What they were doing is converting the IgEs that I have in my mucous membranes to IgG antibodies. It's incorrect to say they were converting it. What they were doing is actually trying to increase the count of IgG. What this does then is it binds to, so the antigen is floating around here. Before the antigen has a chance to bind to the mast cells, the IgE antibodies can bind to it and prevent it from binding to the antibodies. And so if they increase the IgG antibodies, then you're not as sensitive to the allergen as you would be otherwise. And so that's the goal with immunotherapy. Like I said, probably about 18 months that I can remember doing it. I don't know why we stopped. Maybe insurance ran out, something like that. I do remember the shots would be given and I'd have to sit in the office for about 30 minutes to see if there was a reaction. So a lot of times I'd get a little hive that would develop where they gave the shot. Might have worked. I don't know. I don't seem to have nearly as many hypersensitivities as I did as a child. I have asthma, but it's well under control. You know, they used to sell the Primatene mist over the counter. I don't know if they do anymore. I love that stuff. A couple of hits of that and you were wild. Yeah. Anyway, now they sell albuterol, which is they don't do that over the counter either. I think you have to have a prescription for that. That wires you a little bit too. Not like the Primatene though. Again though, I think it might have worked because I don't find myself sensitive to much at all. Poison oak, but we'll talk about that in a minute here. And the other thing that we have to recognize is the shots made had nothing to do with it. As you age, just your exposure to different antigens are going to build your immune system. So maybe the hypersensitivities went away as I aged and as exposure accumulated. However, at the same time, you can develop hypersensitivities later in life. It's not uncommon. My sister, as a child, used to eat strawberries all the time. As an adult, she can't eat strawberries without her lips breaking out into hives. So, you can get different responses depending on, your immune system. You can lose a hypersensitivity as you age, and you can gain a hypersensitivity as you age.
Would lactose intolerance be a hypersensitivity?
No, that's a inability to produce a specific enzyme. It's a genetic thing. Okay, so hypersensitivity 2. This is a cytotoxic hypersensitivity. In this case here, we're talking about your red blood cells and antibody reactions to those red blood cells. So our red blood cells have on them antigens naturally. The type of antigen that you're going to have is going to depend on the blood type that you have. If you have A blood type, then you're going to have a B antigen. If you have a B blood type, then you're going to have an A antigen. If you have an O blood type, you're going to have both antigens. What these are naturally occurring antibodies. Or we have naturally occurring antibodies for these antigens, even without exposure. Okay, so I've told you that you have antibodies once you've been exposed to an antigen. You'll produce antibodies for that. However, if you are blood type A, you have a B antigen even if you haven't been exposed to B blood. They're naturally occurring. Now the problem is, of course, is if you need a transfusion, if you need a blood transfusion, and you have B antigens, well then of course we can't give you B blood, can we? Because then your antibodies will bind to those cells, and those cells will be destroyed. This cytotoxic hypersensitivity is an ADC hypersensitivity, an antibody-dependent cellular cytotoxicity. We've talked about this before. It means that the antibodies are binding to these cells, and then those cells are being destroyed. So, you got to have the right blood type if you're going to get a transfusion, because your natural antibodies will cause the destruction of those red blood cells. However, there is one other antigen that we need to be aware of, and that is the Rh factor. There's a thing called hemolytic disease that can happen to children of mothers that are having a second child, if in fact those children have the wrong Rh factor. And here's how this hypersensitivity can develop. So again, we're talking about an antigen that's on the surface of the red blood cells. Just like these antigens here, A and B. We all have an Rh factor on the surface of our red blood cells. Well, 85% of us do. 15% of us don't. So 85% of us are Rh positive, and 15% of us roughly are Rh negative. We don't have the antigen. Well, here's the problem. If our mother, who is Rh negative, marries an Rh positive male, and they have a child that's Rh positive, well, that's fine. That's all well and good. Except for, during birth, there's a good chance that this child's blood mixed with the mother's blood. And so now the mother has been exposed to the child's Rh positive blood. Upon being exposed, the mother then is going to make Rh positive